Hey everyone, it's Dr. Perlman, and I'm coming to you from the office on a slower morning as we've just gotten over some very cold weather here in Dallas. And I want to show you a routine that I think will help a lot of people with chronic lower back pain and sort of the rationale behind it as well. So, first thing I'm going to do is show you that I'm starting off with something that's called a side bridge. And this is one of the McGill Big Three, and I recommend this for just about everyone who has sort of pelvic, hip, lower back, however you want to misnomer it and or say it correctly. If you have lower back pain, doing a side bridge is going to be one of the best stimulating exercises you can do for your glutes and hip and pelvic area, because that inevitably, if you know how to activate it and turn it on, and as you can see I'm doing the clamshell here, if you can turn that on, you can actually offload pressure on your back by stimulating muscles in your glute. So what's supporting your foundation is more appropriate than what is actually not appropriate, which is you overbracing your lumbar spine all the time because of constant tension. So the second part of what you're going to see is something called the cat-cow. Now, a lot of people do this, and a lot of people think they have to go all the way up on that arch. You do not. You have to wiggle around and find what works for you. And as you can see in the last couple repetitions there, I did a very, very, very short flexion and extension. And then I'm just sort of going into like a modified tiny baby cobra from a child's pose. And there I am, I'm just kind of seeing how much comfort or discomfort there is in the SI joint, the pelvic area, as I rock back and forth so I can just sort of get mobility and stability. And this right here is just me trying to work on thoracic rotation for no reason at all other than maybe to get a crack in my back. But, there's no reason why you should have to do that. And now what I'm going to do is turn to the side, and I'm going to show you a proper squat. And the reason this is important here is a lot of people don't know how to squat. They don't know how to hip hinge. Here comes the improper. Nope, that's not how to do it. Don't ever go straight up and down. You have to go all the way back with the butt. Butt back, knees out. I'd rather have your shoulders forward like I'm doing there than having the up and down where the lumbar is loaded. Now, the next thing that you're going to see here is that gym routine that I I went in the other day and I said how to decompress your spine. So here it is, decompressing the spine. And yes, you have to get your groin crotch comfortably over the edge of the pad. You can't have everything too far back on it because then you're flexing the lumbar spine. What's amazing here is even though I'm going out of my way to flex and open the facets and the joints of my lumbar spine, they're actually fairly locked in neutral, even with my SI joint, because my SI joint is forward over the top of the back extension pad. And so what you're doing is you're decompressing, lengthening the spine, which you can actually learn to with like your head down to the lower back, how to do it vertebra by vertebra and sort of control segment by segment, but that's for another day. And then you're just gonna go, up and down, but slow and control on the negative. It's not so much coming up and contracting, it's slow on the negative. So you can learn to basically have control when you bend forward. Along with controlling the pelvis, you should be able to train your body with reciprocal inhibition. And what this means is walking backwards and offloading the back with having a harness or battle ropes around the waist. I have a separate video on that. And then over here is me in a video where I'm doing thoracic extension. So a lot of times the pain in the middle back is due to compensation from something in the lower back area. And a way to work on this is with the elbows on a bench or chair and head through as you work on your thoracic extension. And as always, a lot of this is not even achievable without the chiropractic adjustment. So as I finish this video with a clip of a few reels of me making some adjustments throughout my young career, I just want to remind everyone that really chiropractic, when it comes to pain, is oftentimes like the gateway drug. You cannot achieve some of this rehab and motion without the pain being completely gone due to chiropractic.